We're here with consultant plastic surgeon Miss Siún Murphy to talk about breast reductions. Siún, let's talk a little bit about breast reductions. Who's a suitable candidate? What's involved? Is it a really serious hardcore surgery?
A bit like tummy tucks, I think breast reductions have changed radically over the last couple of years, and all to benefit the patient's recovery. And most of us now will do a non-drain breast reduction, which means that you don't necessarily need to have to stay in overnight. I would do all my breast reductions as day case surgery. A lot of my colleagues do the same. No drains, no major binders. You can have dinner that evening, feel fine. It's actually not that sore. A lot of the techniques that used to be used in the past used the skin. If you can imagine, there are two kind of components to breast reduction surgery. One is reshaping the breast, as in reshaping the gland, and the other is about reshaping the skin and taking out the redundant skin. So if you have tension on that skin and you're using the skin like a bra to make the breast nice and tight and pert, it's going to be a little bit more sore than the more modern techniques, which reshape the breast on the inside and the skin just pulls together, which means it's a very recoverable operation.
That's really interesting. One of the things I would be most interested about, and the question that kind of comes up time and time again, what happens to your nipple? Do you have to really cut your whole nipple off?
There's an urban legendary out there that every nipple for every breast reduction has to come off and be repositioned and plopped back on elsewhere. We do use that technique, but it's for very, very what we call ptotic breasts, or very droopy breasts, where there's a humongous difference between this little notch here and where your nipple is. And if your nipple is 35 centimeters away from this point, you may end up needing a nipple graft. 9 times out of 10, we don't need to do that.
And scarring. Let's talk about scarring.
I primarily use what's called a lollipop scar, so I use a technique that doesn't use the anchor scar. So the scarring that I primarily use is around the nipple and downwards.